At the end of the previous lesson, we will talk about nursing assessment frameworks MODULE3.3 tools for identifying vulnerable populations. In this lesson, we will start with the second part, the assessment tools and data sources, which further enhance this process. The Change Tool 500 organizes data on community assets and needs, while the Area Deprivation Index 80 maps disadvantaged areas at the census block level. Tools like the Health Impact Assessment HIA evaluate policy impacts on vulnerable groups, and social needs screenings assess social determinants of health such as housing and food security. Resources like county health rankings and GIS mapping provide spatial and comparative analyses of health risks and resources. Together, these frameworks and tools enable nurses and healthcare professionals to identify vulnerabilities, plan interventions, and promote health equity. A comprehensive community health needs assessment integrates diverse data sources and analytic techniques to capture both quantitative trends and qualitative insights, enabling a nuanced understanding of population health and vulnerabilities. A comprehensive community health needs assessment draws on multiple data sources and analytic methods. Epidemiological and quantitative data, including census data, vital statistics, BRFSS, hospital-ID records, disease registries, county health rankings, AD and CIVI capture demographics, health behaviors utilization patterns, and geographic vulnerabilities. Qualitative methods such as focus groups, interviews, community surveys, and windscreen surveys provide insight into lived experiences, barriers, and social determinants of health. These data are analyzed through demographic profiling, disaggregation to uncover hidden disparities, GIS mapping to visualize risk clusters, comparative benchmarking, and trend analysis to detect emerging needs. Structured prioritization models combining quantitative scoring, group facilitation, and expert consensus enable public health practitioners to systematically identify and rank health needs, ensuring that interventions are both evidence-based and responsive to community context. Prioritization models for health needs provide structured, evidence-informed frameworks that enable public health practitioners and community stakeholders to systematically rank competing health concerns and allocate resources where they will have the greatest impact. Among the most widely applied approaches is the Hanlon method, which quantifies priority through the formula A plus 2B where A represents the size of the problem, e.g., prevalence or incidence as B captures its seriousness in terms of urgency, severity, and economic burden. C reflects the effectiveness of available interventions, and D encodes the Pearl criteria, propriety, economics, acceptability, resources, and legality, a composite judgment of whether an intervention is feasible and appropriate within the given context. This method integrates epidemiological data with community input, making it particularly well-suited for complex issues such as social isolation in older adults. Often employed as a precursor to the Hanlon method, the Basic Priority Rating (BPR) system offers a complementary systematic scoring approach that evaluates health problems across three core dimensions: magnitude, importance, and intervention potential, thereby enabling side-by-side comparison of multiple health issues before deeper quantitative analysis is applied. Where these quantitative tools may overlook community voice, the nominal group technique introduces a structured group process in which participants independently generate and then collectively rank health priorities, ensuring that diverse perspectives are equitably represented in decisions concerning issues such as access to care or chronic disease management. Complementing the NGT's group dynamics approach, the Delphi method employs iterative rounds of anonymous surveys among a panel of experts and stakeholders with aggregated feedback shared between rounds until consensus emerges. This approach is especially valuable when prioritizing complex, sensitive, or emerging health needs in vulnerable populations where direct group deliberation may be impractical or subject to social pressure. Together, these four models spanning quantitative scoring, structured group facilitation, and iterative expert consensus form a complementary toolkit that public health programs can deploy in combination to produce rigorous, inclusive, and defensible health. Effective public health nursing requires a multifaceted, evidence-based approach that centers on community engagement, cultural competence, data-driven decision-making, collaboration, and ongoing evaluation. Identifying vulnerable populations is a cornerstone of community health nursing. By leveraging structured frameworks, robust data sources, and participatory priority models, nurses can systematically assess risk factors, prioritize health needs, and implement interventions that are both effective and equitable. This approach not only addresses immediate health disparities but also empowers communities and advances health equity.